Welcome back to the show. I'm here with Dr. Ronald Johnston from Advanced Dermatology and Skincare Center. Welcome back to the show, Doc.
Glad to be here.
You know, one thing that I've noticed, the popularity of tattoos has increased exponentially since I was a young guy. And not just guys, but a lot of gals are getting tattoos as well. Some of them have buyer's remorse. And they wind up in your office and say, hey, what can you do about this? What can you do about it?
Well, basically, we've got the one of the latest lasers called the Picosure Tattoo Laser Removal System, and it's the latest and greatest as far as it's able to take the laser off in fewer treatments. It's still uncomfortable, but like you said, there's a lot of people out there who either don't like their tattoos anymore, they just don't look as good anymore, or they want to get different tattoos, so we'll laser the tattoo off so they can get a different one.
What'd you call that? Laser Picosure? Is that what you call it?
Picosure. That's just the name of the
That's a brand
company,
name?
brand name. But what it happens is it's based on the fact that it uses picosecond technology, which is a time period, which is a very short time period. So it's able to put the energy into the ink and explode it apart in a very short time period. You're talking nanosecond, and picosecond is even shorter than a nanosecond.
So explain to me what I know what a tattoo is, but I'm not sure I know how they work. They inject a little bit of ink just under your skin. Is it under your skin or in your skin?
It's right in the skin. A good tattoo artist is going to put the ink basically right below the epidermis, right in the upper part of the dermis, which is the deeper part of the skin, and put it at a nice even level. And a good tattoo artist is able to put it there, as opposed to maybe a more inexperienced tattoo artist is going to put it at varying depths and things like that, where you get sort of a different shading or a different appearance of it. And so he just plops all that ink in there, and that ink just stays there, and it's too large of a molecule for the body to take away, so it just lets it sit there.
It just stays there. Now, tattoos fade naturally over time, don't they? And people go in to get them tuned up, don't they?
They can. Your skin changes over time, and so that changes the tattoo a little bit, and your body may take a little bit of it away over time. And that's really how the tattoo laser system works, is we put the energy into the tattoo and explode it apart into little droplets. Those little droplets, then the body comes in over the following weeks to months and actually takes away. So it's not actually the laser doing all the work and exploding the tattoo and removing it. It's actually the tattoo just setting the tattoo ink up so that the body can come in and take it away like a foreign body.
And what happens to all those ink molecules? They take it away as a foreign body and it gets metabolized somehow? Is it just internally? Does it stain your innards, or what?
No, it just takes it away. It just excretes it.
Breaks it down,
and then just sort of excretes it either through the urine or something like that, or gets rid of it like it does for most little particles or things like that. Because you're talking extremely tiny, tiny little particles that it's just going to get rid of in one way or the other.
Now, how many times do you have to go in for a laser treatment? Is it something you have to, every so often go back to get a tattoo removed, or can you do it in one sitting, or how's that all work?
No, it's not going to take one sitting. Usually it's going to take, with our Picosure tattoo system, it's going to take 4 to 6 treatments is a good average, where in the old days with the older systems, which is the other lasers, it took anywhere from 10 to 12 treatments, if not more, to get rid of a tattoo. And you're usually doing those about once a month, maybe once every 6 weeks.
So you have to give your skin a chance to kind of recover from the treatment and for the ink to disperse a little bit and the body to do its thing.
Correct. You got to give the body a chance to come in with its troops and take away the ink and get the job done. So you want to give the body a chance before you hit it again, and all you're doing is exploding that ink apart more and more so that the body can take it away.
How popular a procedure is that? Are a lot of people going there? Are you busy?
Very popular. The Picosure tattoo is probably our busiest laser as far as people coming in and wanting to get it done for various reasons. There's always some good stories with why they want to get it taken off, or a name that they no longer want on their body, or whatever the case may be.
That's always a mistake, people. Never put the boyfriend's or girlfriend's name on you. You just never know.
That's right.
Yeah, so people have buyer's remorse on it, and they service people too. The standards change over time, where you can have tattoos and how big they can be and things like that.
Yes, we've seen a number of military personnel who have to come in and either the tattoos in an area either shown where they can't have it, or it's maybe something that's not politically correct that maybe was a good idea years ago or in high school, but that they can't have for the military.
Yeah, and that's one thing about a tattoo. You really do have them forever, but not necessarily so if they come and visit you at Advanced Dermatology and Skincare Center.
Absolutely. We'll take care of it.
Dr. Ron Johnston, thanks so much for coming on the show and getting us smart on how to get rid of those tattoos if you don't like them anymore. And we'll be right back after these messages.